patients if you don't give them medicine?
Well, I do use medicine, but I try and keep everything as non-toxic as possible and as non-invasive as possible. So my concept, the infusio treatment concept, has to do, as I say, with taking medicine out of the doctor's office. So demedicalization is a big factor with us. And surprisingly enough, just that works as medicine. Yeah, have the patient in a very relaxed state. All of a sudden, things work much better for them. Yeah.
Yes.
Then I like to use lots of infusions, or IV infusions of natural substances, things like vitamin C, calcium, magnesium, amino acids, just basic building blocks to build up the body and give someone more resilience, basically. Yeah. And then a key factor in our treatment is looking at the immune system. And we don't just boost the immune system, because if an immune system is not functioning properly, usually that's because the ratios of the immune cells have been skewed somehow. So if you just boost the immune system, you have more cells, but that ratio is still skewed, so you're not really changing anything. So we do something which we call immune modulation, which is basically changing the ratios of those cells, and once you do that, the immune system kicks in and starts to do its job. So it's a very foundational therapy, but it's an extremely effective therapy.
How do you boost people's metabolism? Because I found that to be really a problem, especially with women over 40.
A main part of our therapy is thymus therapy, which is part of the immune modulation. We know the thymus gland, it programs our immune system, but the thymus gland also has a lot to do with hormone balance and with our neurotransmitters. So by doing thymus therapy, by doing the immune modulation, we actually repair the function of the thymus gland, and that in turn helps with hormone balance and the balance of neurotransmitters, and that in turn helps with the metabolism. So it's kind of a very foundational thing, but it has a chain reaction of healing in the body, basically. Yeah.
Okay, so who are your patients, and where do you have offices? Are they all walks of life, teenagers on? Are there toddlers to, centurions?
Yeah, it's basically everybody. I must admit, I don't see very many children. It's mainly, I would say, starting mid-20s, early 30s. I see a lot of young women in that age range. Many young women have problems with either polycystic ovaries or other autoimmune things such as lupus, fibromyalgia. We see that's a typical patient group. Men I usually see once they get into their 40s. That's when testosterone levels go down and things like that, so they're having different problems in that area. A lot of young men I see have problems with depression, just not feeling good, not being able to perform the way that they should do. I see these people.
And what do you give them for that? The infusions?
The infusions, immune modulation.
So you figure out what their body needs and how much and how frequently? Like if someone came in, say a 40-something came in with depression, a male,
right, yeah.
Since we just talked about a female, what would you say?
What would I say? Well, first I would do my Global Diagnostics, because that would give me an idea of what's going wrong, because just not feeling good, just having depression, usually that's a symptom of something else. So I'll look and see, what can I do there. And then we have some foundational treatments, immune modulation, fixing the thymic function, so that will balance the hormones and neurotransmitters. If I just give the body a boost with just, as I said before, just general vitamins, minerals, amino acids, that is sometimes enough just to fix the problem. So I'll try that first, and if that doesn't work, then we'll go more into detail.